The medical advancements that we have been enjoying over the past several decades, and especially the past several years, are nothing short of amazing. And as we all get older here in our community, our orthopedic friends and the orthopedic physicians are so important to keeping us moving and keeping us flexible. Joining us via Zoom right now is Dr. Ronald Lederman, orthopedic surgeon and sports medicine doctor at Lederman Kwartowitz Center for Orthopedics and Sports Medicine at Lakes Medical Center in West Bloomfield. Dr. Lederman, thank you very much for joining us here on the Splash Live.
Good morning. My pleasure. What a day, huh?
It's beautiful. If you were an oncologist, you'd probably tell me to get out of the sun, but it's really nice poolside here. Thank you for helping us continue to move. You know, when I think about aging, and I'm getting there, without our mobility, we are so restricted. So the work that you do is beautiful work. Thank you.
Well, thank you. I appreciate that. And most people think that as an orthopedic surgeon, you only come to us when you need surgery. But at Lederman Kwartowitz Orthopedics, where we have myself, Dr. Kwartowitz, Dr. O'Keefe, we now have a new total joint specialist, Dr. Gibson, and several other doctors to help people maintain their independence, like you said, flexibility. Our goal is to keep our patients out of the operating room. And in
Dr.
doing
Lederman,
that, yeah.
Go ahead. I'm sorry.
No, I was just going to say that we have an amazing physical therapy team that specializes in gait training, balance, fall prevention. So we take patients in our community in our physical therapy and get them stronger so they can maintain an independent lifestyle.
When is it a good time to call you? At what point in our life cycle? Should we call you in our 30s and 40s? Should we wait till we really run into a problem in our later years? When do you want to hear from us?
So we take care of the entire family from ages 2 months to 100 years of age. So if you have an injury and you're hurting and it doesn't go away in a day or so, you give us a call. We have fellowship trained sports medicine specialists where we specialize in minimally invasive ligament reconstructions for the high school and college basketball players, or people like us, that weekend warriors. You want to get out there and do something. And if you injure your Achilles tendon or your rotator cuff or a meniscus in the knee, you give us a call. It doesn't mean you're going to the operating room.
You know, we're sports fans here, so I wasn't planning on going off on this tangent, but you are a sports medicine operation. What do you think about Williams, this receiver who's got this ACL injury? Are people coming back from these injuries that 5 years ago, 10 years ago would have been career ending?
Absolutely. You know, as a young kid, I remember watching Brian's song. And when Gale Sayers tore his knee up, he was done. But nowadays, you have these minimally invasive techniques to fix ligaments and get athletes back to the level that they were at.
Now, my notes indicate this morning, thanks to our wonderful producers, that stem cells are playing a role in joint healing. Can you talk about that?
Yes, we specialize in regenerative medicine. And the term stem cells is somewhat controversial, and I won't go into it, but we utilize regenerative type injections that have given hundreds of our patients incredible pain relief from severe arthritis. It's allowed patients to kick the can down the road in needing a knee or hip or joint replacement. But I will say this, and another very exciting cutting edge technology which we specialize in, Dr. Kwartowitz and Dr. O'Keefe are doing robotic, minimally invasive joint replacements of the knees, the hips, and it's very exciting.
So you are building in 2022 the $6 million man or woman.
That's exactly right.
You know, it's amazing from our teeth and, I got a little bit of work here all the way through all of our joints in our bodies. It's amazing what you're doing. And is there anything else that you think, especially to our elderly community here in West Bloomfield and the greater West Bloomfield area, any other tips or any other thoughts you want to share with them today?
Yes, just yesterday, Dr. O'Keefe and myself were at the West Bloomfield Parks and Rec, and we were talking to a group of seniors who were there trying to maintain their independence and even looking at their options of assisted living. Our goal is to improve quality of life, to maintain patients' independence and level of activity. And the best advice I can give someone is give us a call. We can easily get you into our therapy program to improve flexibility, core strengthening, your balance, avoid a fall, avoid a fracture. But if you have arthritis, which we all get as we get older, give us a call and let's see what your options are, because the options are amazing today compared to just 5 years ago.
Dr. Lederman, we could do an hour with you, and we will on another day. But thank you for joining us this morning for this brief visit. Can you share with our viewers your contact information if people want to get a hold of you out of the Lakes Medical Center?
Sure. Lederman Kwartowitz Orthopedics, I believe it's lkorthopedics.com. You can make appointments on there on the website. Give us a call at 248-669-2000. That's one number to reach all of our doctors and the physical therapy. And let's just enjoy the rest of this summer. But we're here for you if you need us.
All right. I feel like I want to go for a walk right now. Dr. Lederman, thank you. Thank you very much for keeping us all moving. Good to be with you. I really appreciate your time today.
Thank you.